Health Today is brought to you by
It is essential that each of us make healthy lifestyle choices to reduce our cancer risk. These lifestyle changes include consuming healthy foods and drinks, quitting smoking, reducing alcohol consumption, increasing our physical activity, and attaining adequate rest and relaxation. Dietary changes of specific interest include limiting the intake of red meat and avoiding processed meats. This is Nurse Lisa, and remember, the nurse knows.
Health Minister John Boyce joined regional health officials this week to tackle the issue of childhood obesity. They say the figures are worrying and something must be done.
According to Dr. Audrey Morris, the advisor on food and nutrition at PAHO, the number of obese and overweight Caribbean children has doubled in the last decade. The World Health Organization in 2013 estimated that the number of overweight children under the age of 5 years was something like 42 million globally. Close to 31 million of these were living in middle and low-income countries.
Boyce says obesity is affecting several aspects of children's lives.
I remain deeply concerned about the issue of childhood obesity. Obese children are at a higher risk for hypertension, high cholesterol, heart disease, diabetes, breathing problems, and some cancers, which can cause long-term illness and premature death. In addition, obesity in childhood may result in social and physiological problems such as discrimination, bullying, low esteem, and social isolation, which ultimately lead to a reduced quality of life.
And overall figures for Barbados are not very encouraging.
The Global School Health Survey published in 2012 indicated that among school children in Barbados aged 13 to 15, 32% were obese with body mass indices of more than 29, 14.4 were overweight, less than 30% had the daily recommended amount of physical activity, 15% had no fruit or vegetables in as long as a period of the last month. 70% drank carbonated sweet drinks at least once a day. About 18% ate from fast food restaurants 3 or more days weekly. The students had overall low levels of physical activity, with only 1/4 reaching optimal WHO prescribed levels.
Boyce says this data contributed to the development of the Barbados Childhood Obesity Prevention Program.
The action plan identifies 5 strategic lines of action. These are strengthening of breastfeeding practices, promoting physical activity, implementing the concept of a health promoting school, strengthening coordination and management of obesity prevention, and developing and implementing dietary, regulatory, and fiscal policies.
The Executive Director of CARFA, Dr. James Hospitalis, says fighting childhood obesity will be difficult, but they are determined to win the battle.
What we're embarked upon is not easy. No country in the world has turned around an obesity epidemic at national level. You could find countries that have done something in tobacco, hypertension, traffic injuries. No country in the world has turned around an obesity epidemic at national level. But we in the Caribbean, in the process of cooperation and health over the last 20, 30 years, have faced major challenges and been first in the world to do certain things, such as the elimination of measles in the 90s. So why shouldn't we be the first in the world to turn around an obesity epidemic, beginning with our children?
That's Health Today. For more, you can log on to our website www.barbadostoday.bb. I am Marie Claire Williams.